Hi, everybody. I am Dr. Christine Anderson. I am a pediatric and pregnancy doctor, chiropractor in Los Angeles. And I'm here tonight to talk about pregnancy and chiropractic. Just a little bit of a background of my story. I've been a chiropractor for 30 years, or over 30 years actually. And for a good part of it, I have been doing pediatrics and pregnancy. I got pregnant right out of chiropractic college, and I actually took my boards when I was 5 months pregnant and gave birth to my first child, my daughter, who is also now a chiropractor. And soon after, I started my board certification in pediatrics and pregnancy through the ICA pediatrics program. And then, about over 10 years ago, I then did the certification program through what was then the Carrick Institute. It's now switched over to be called IAFNR in functional neurology, and I got my certificate in childhood developmental disorders. So I've been doing pregnancy and prenatal chiropractic a long time. Um, and I'm going to share with you a little bit about what the benefits can be. So, obviously, I experienced pregnancy and I had chiropractic with pregnancy, 3 pregnancies to be specific. And I never had a pregnancy without, so I can't tell you the difference, but all I know is I don't know how women go through pregnancy without chiropractic because it can make such a difference in how you feel and just your overall health and well being, as well as setting your body up for success in labor and delivery. So, let's just get started right away with this. Um, so, with my pregnancies, generally I had good ones. I did have a little bit of hip pain with my second pregnancy, but there were a few things that I'll talk about that were really prevalent, especially number one of the first common pregnancy issues being morning sickness. And unfortunately, I did have morning sickness. Um, with each pregnancy, it got a little bit worse. Well, my last pregnancy, it was pretty bad. But I never really had vomiting, just a lot of nausea, and chiropractic helped. Just making sure I was eating on a regular schedule helped. If I skipped a meal, forget it, it was not good. And yeah, it's no fun, but it's there because we'll talk about why it's there in the first place. But it's actually a good sign because it means that there is a hormone present that is the pregnancy hormone. So, chiropractic can help with nausea and vomiting by improving your overall nervous system functioning. So, the brain controls all the functions in the body, and therefore, a chiropractic adjustment can help with your balance of hormones and also to lessen the severity of your morning sickness. So, again, if you're getting chiropractic the whole time, it's hard to see what it would be like if you didn't have it. But all I know is that in my family, my sister really had a hard time and she was hospitalized for dehydration. And that never happened to me. I was able to work through all my pregnancies. As far as digestive issues, these might be things like heartburn or constipation, and it's the same principle that if there is any interference going on with the nervous system, then that's going to affect your overall functioning. And the movement of food through the digestive tract is dependent on the brain telling the body to move it through, and that's through those spinal nerves. Now, we'll spend a bit more time here with back pain, rib pain, pubic bone pain, any pain in the body, round ligament pain. I'm going to talk more about that, but basically, studies show that between 50 and 80% of pregnant women suffer from low back pain during the pregnancy. And the hormones of pregnancy are usually in play when it comes to talking about pain. And I'm going to go into those in more depth in a minute. Now, with sciatica, a lot of times this occurs because of the growing baby actually physically puts pressure on the sciatic nerve, which is the nerve that comes off between the fifth lumbar vertebra and the sacrum. So let me grab my trusty spine here. So here's the sacrum, the triangle-shaped bone at the end of the spine, the fifth lumbar vertebra, and this nerve, it's hard to see it here, coming off is the sciatic nerve, and it goes down off the back, down the butt, all the way down the leg. It is a super long nerve, and this can become compressed, as well as the misalignments that go in the spine can create a problem. Now, headache is really common in pregnancy. I did have a little bit of tension headache that it felt like it was pulling at the back of my head. It can also be due to hormones. So a chiropractic adjustment is going to help align your spine and reduce the tension. And believe it or not, if you are a migraine sufferer, typically migraines will reduce in pregnancy due to the hormones. Now, as far as insomnia, that can be due to discomfort or pain. It can be due to blood sugar dropping during the night and waking you up to eat, like happened in my last pregnancy. And it also has a lot to do with the balance of the autonomic nervous system, which is the parasympathetic system, and the sympathetic nervous system, and that's the gas pedal versus the brakes. So the go, go, go versus the rest and digest. And if this is out of balance, it can certainly disrupt your sleep. And this is where, again, chiropractic can help shine by helping to normalize your nervous system. And I think sometimes, too, it's a little bit of prepping for what's going to be happening when you have your baby. You might get up to go pee a couple of times a night, and hopefully you're getting back to sleep. So I think it's a little bit of practice for that, too. Now, as far as things like carpal tunnel syndrome, this is where you're going to have some wrist pain, and a lot of times this is common in pregnancy because of the ligament lying on the nerve in the wrist. There's a ligament right here. And there's also more fluid in the body with pregnancy, just with the normal physiologic changes. So that tends to put more pressure there and create less space. And if you are already a mom and you're taking care of kids, or you're using your wrists with typing or anything like that, that's going to put more stress on it too. So chiropractic can help by making sure that all these bones in here are lined up, and then working on some of the muscles. Now, as far as fatigue, you are building a baby when you are pregnant. So you are going to need to take some breaks. I mean, this is just common sense, right? But with chiropractic, it can help with your overall functioning as far as decreasing the stress in your body, decreasing pain, enhancing that you're going to be taking in good nutrition to supply fuel for your body. You're going to be moving your body and exercising again to make sure that you have enough energy. And also a positive mindset, because depression will also create fatigue. Now, with gestational diabetes, this is a big one, and it is one of the risk factors if you are overweight or obese. And this is becoming more and more prevalent, not just in the US, but worldwide. So if you are having a chance to plan for conception, it's better to lose weight before you get pregnant. But let's just say you are pregnant, surprise, and you need to lose some weight. So you're not going to go on a diet when you're pregnant, but you're going to modulate what you're eating as far as decreasing your sugar intake, if not eliminating it altogether. And I tell my patients to eat as if you are a diabetic, and then you will not have a problem with gestational diabetes, which is a condition that occurs in pregnant women, and they don't necessarily have to have a history of diabetes before. And this is really important because there are risks to the mom and the baby with gestational diabetes, including a really big baby. So, if you have a really big baby inside you, you have to get it out of you. And, we are designed to stretch, but there is a limit. And if you have too big of a baby, there may be some interventions in there. So, if we can keep everybody healthy, then this is going to help get the outcome that you are hoping for. So let's just talk a little bit about the hormones of pregnancy. So when you get pregnant, at the bottom there, you're going to see HCG, that's human chorionic gonadotropin. And this is the hormone they are testing when you take a pregnancy test. Or let's just say you are pregnant and you want to make sure you are continuing to be pregnant. This is a hormone that's going to rapidly increase in the first 3 months, and then it's going to rapidly decrease. So it's a way to see if that pregnancy is progressing or not. But it is also the one responsible for that morning sickness. So this is why, or all day sickness, right? It doesn't even have to just be morning. So this is why I say it's actually a good sign, because if you are feeling nauseous, it's most likely that you have a high level of HCG, which means that you're continuing to be pregnant, right? Until about 3 months, when that drops off, and hopefully you're starting to feel better in that second trimester. All right, so progesterone is going to relax muscles, estrogen is going to increase the movement of the joints, and the star of the show is a hormone called relaxin. And this is the one that is going to make your joints looser and your ligaments looser and, your pelvis, ideally, but also your entire body, all the joints in your body. So this is going to make you more prone to injury, because ligaments are supposed to keep us glued together. They're supposed to hold us together. And they're unable to do that effectively. And therefore, it's going to make your vertebra, your bones, your joints to go out of alignment way easier than they would do if you're not pregnant. And then on top of that, muscles are trying to take over the job of the ligaments, but that's not what they're supposed to be doing. Muscles are supposed to be moving your body. So because they're more relaxed with the progesterone, they're really having a hard time. And this is why muscles can get strained and overloaded. And this is why it's going to place more stress on your body, so that, you'll be sitting there, you'll be fine. And then you go to get up and it's like, oh my gosh. So making sure your spine is aligned, your pelvis is aligned in pregnancy is going to make the job so much easier for your muscles, because any misalignment is going to put stress on them even more. All right, so seeing a chiropractor is a good idea to keep that back pain away and make sure everything's lined up so that you're not making more stress. And that relaxin as well can create the diaphragm to be a little bit lax and let the space where your esophagus usually is, it gets a little bit relaxed. It's called a hiatus, and then the stomach starts pressing up there, and that's where you get heartburn. So there are techniques to help bring that stomach down a little bit and get the diaphragm a little bit released. All right, let's go on to pregnancy posture. So because of all these hormonal changes, a lot of the back pain is going to be caused by postural problems, because of the heavier and heavier belly that starts to occur as the baby grows. So in the diagram, you can see incorrect upright posture and correct upright posture. And I mean, we want to have good posture no matter what, but especially in pregnancy because the breast weight, as it increases, can round the shoulders even more and strain the upper back. Our rib cage naturally expands when you're pregnant. And so, if you've got poor posture, you can strain the upper back or even have those ribs go out of place because ribs are moving naturally as we breathe. Now, there's this increased lumbar lordosis naturally with pregnancy. That's that low back curve. And you can see it there. It increases even more if the pelvis is tilted and shifted forward as the baby, in, being in the front, starts to pull down forward. So, by keeping that proper posture of the back core engaged, it's going to help take a little bit of that curve out of the low back, as you can see there, and that's going to take pressure and stress off the rest of the spine. So adjustments can help with the posture. Oops, I lost my picture. There we go. Adjustments can help with the posture, and they can also help with the alignment to keep the back pain at bay. And a lot of times, prenatal chiropractors are also going to educate you on exercises you can do to help support your spine, or if you need additional support, like a maternity support or a trochanter support, which is going low on the hips. So this is something else that I can help with, or a prenatal chiropractic can help with. All right, let's go to the effectiveness of chiropractic in pregnancy. So what this really is talking about, there are a couple of studies, and I will put the links to all of these in the description. This particular one is Pregnancy and Chiropractic, a narrative review of the literature, and it has gone through and looked at what the results have been of chiropractic and concluded that chiropractic during pregnancy may be considered to be safe and effective in treating common musculoskeletal symptoms in pregnant women. So pain, right? Back pain, rib pain, pelvic pain, headache, tension headache, that type of thing. And in 75 to 84% of pregnant patients had relief of pain with chiropractic. So this is a huge percentage. On top of that, chiropractic significantly decreased the incidence of back labor, and that's where in labor you've got contractions occurring in the spine, in the back, because of the nerve roots. There are sensory nerve roots that go to the back, and when there are misalignments occurring, this can create that sensation of back labor. And so this is another reason why chiropractic is really helpful in pregnancy, and if needed, in labor too. And I've gone into many labors and helped women with any issues that have come up, from not progressing in labor to having pubic bone pain or pelvic pain or low back pain or hip pain or whatever type of pain that's preventing them from not only being comfortable, but it can actually prevent the baby from leaving her body. And we're going to talk about that in a second. Now, the last aspect here, Webster Technique, a study showed that 92% of cases resulted in resolution of breech presentation. So this is breech presentation of the baby. Webster Technique done on the mom and the baby going into the optimal head down position. So let's look a little bit more at this. And just briefly, and I'll put a link to a podcast my daughter and I did on the Webster Technique that will go into it in way more detail. But basically, the late Dr. Larry Webster, he's a chiropractor, no longer with us, but he developed this specific chiropractic analysis and adjustment technique, which enables us as chiropractors to establish alignment of a pregnant woman's pelvis and reduce undue stress into her uterus and the supporting ligaments. So basically, we're working on mom to make sure her pelvis is in an optimal position, right? We want everything lined up so that the baby can come out of here. And this is, there are different shapes and types of pelvis, but that's, you guys get the idea, right? We want to have everything lined up properly. If it's twisted and torqued, it's going to cut off that exit, and it's going to make it uncomfortable for that baby to get into a head down position. So I kind of think of it like the baby starts to go in a head down position. It's not comfortable because there's not enough room there. There's bone there. It doesn't feel good, and the baby goes, nope, I'm going to find another position, and goes into a breech position, a transverse position, whatever you want to call it. And until you get that pelvis aligned, they're not going to want to go head down. Now, there are other things that can prevent a baby from getting into head down position, but the majority of the time is due to what's going on in mom's pelvis. So the Webster Technique really is something that is useful to be done during pregnancy, no matter what your baby position, just to make sure that everything stays optimal. And I check this on every pregnant woman who comes in to make sure that, number one, her sacrum is in the right position. It's that triangle-shaped bone. And that the ligaments in the front of her body, especially the round ligament that tethers the uterus, and we want to make sure that that is not too tight so that it's not pulling on the uterus. And it's a really simple technique, very non-invasive, very comfortable, and it provides so many benefits. And I was actually really lucky enough to be taught by Dr. Webster himself, and I was taught the day before I gave birth to my second child. So, who actually came, was like, he was so quick. By the time I figured out I was in labor, it was really early in the morning. It was like 7:30. I was actually getting ready to go to the seminar. My midwife came over, said, you are 8 centimeters dilated, and he was born by 10 minutes to 9 in the morning. So it was in a very short period of time. And this is, again, one of those benefits of chiropractic that we see, is that it can help facilitate labor and birth. So let's start at the top, and I'll talk a little bit more about why that's so. It's drugless, it's non-invasive, and overall safe. We saw it in that one collaborative study. And you can always tell the safety of a technique or a therapy or modality. Just find out what chiropractors normally are charged for their malpractice insurance. I know this sounds kind of weird, but for instance, OBs have it's huge. I mean, it's tens of thousands of dollars to have malpractice insurance when you're birthing babies, because there's an inherent risk in it. For the most part, everything works well for women, but occasionally things happen, right? But with chiropractic, we have very low malpractice insurance because we are not doing anything invasive. And sure, there are some things where I might modify or maybe not adjust, but that's where you go to a chiropractor that has training in pregnancy and in pediatrics, because we know what to look for. And therefore, when we are working with women, we're modifying our technique. Because of the loose ligaments, you don't have to do very hard work. A lot of it is very, very gentle, because everything is just going to easily go into place. Reduces stress in the mind and body, and this is huge. I could probably spend a whole segment just talking about this. We know that if a mom is stressed in pregnancy, her baby is going to experience those stress hormones and then therefore can be stressed. So that can be alleviated with chiropractic, as well as the body. So physically feeling better and not being in pain or discomfort is, again, taking stress off the body, stress off the mind. Mom can move, mom can sleep. She's going to feel good. Um, she's going to have a good state of mind. So this is huge. And then just overall better health and well-being. This is when you're pregnant, this is when you're not pregnant. The whole goal of chiropractic care is to address or remove any obstructions to the nervous system, which can be preventing your organs and your immune system and your hormonal system and every other system from functioning at optimum levels. So the better your body is functioning, the better your health and state of well-being. That's it. The more apt you are to continue with your healthy practices, such as regular movement, sleep, nutrition, that type of thing. And then this optimizing baby development. So a pelvis that's out of alignment can restrict the amount of space available to the developing baby. And you'll often hear it called intrauterine constraint. When babies can't move freely, they can be kind of stuck in a position that's going to affect their development because they need to move. And it might even create birth defects just from the pressure. And chiropractic care during your pregnancy is going to help maintain that optimal pelvic balance so your baby can move freely, get in the head down position, and get ready for birth. And this leads us to the easier and faster births. So chiropractic care, regular chiropractic care, I should say, during pregnancy can possibly decrease labor time by about 50% or even more. So I had all natural, non-medicated vaginal births for my 3 babies. And my first one was pretty textbook. It was almost as if my daughter read the textbook. You know, the mucus plug comes out, your water breaks, the contractions come on, they increase, and voila, you have a baby. So this occurred, I started really going into labor maybe about 3 a.m. and I gave birth to her about 9:10 a.m. So really great. You heard about my second one. My third one, I was actually in my office because I went into labor right before my office hours. So I started, it was around 2 o'clock-ish, 2, 3. 3 it started getting a little bit more intense. But I went into my office. I actually was adjusting patients till about 4:45. And then I went home and gave birth at 6:45. Now, I am not advocating for this. It's not like I was planning on doing it, but this is what happened. And yeah, so these were all um, fairly easy, everything progressed as it should, and I don't think that is by accident. I do think this is because of the benefit of chiropractic. That aligned pelvis allows for a maximum pelvic outlet for the baby's head to fit and get into position. It's also going to help with the whole birth process. So initiating labor, getting the cervix to dilate, getting the uterus to have rhythmic, forceful contractions that are coordinated to have the power to push the baby out and have no interruptions. Your environment certainly helps as well. And I had my daughter in the hospital just by design, not really for any other reason except for I just graduated school, didn't have much options as far as um, payment. But my other 2 I had at home, and it's incredible to be in your own home and in your own environment. That worked for me. So the other aspect of chiropractic with getting everything to go as it should, because our bodies as women are designed to do this, is that if you have a shorter, more productive labor, you most likely will reduce the need for analgesics, any interventions, as well as preventing birth trauma. And this is what I hear sometimes from women. I mean, if you're in labor for 3 days in extreme pain, yeah, you're going to want to get an epidural, right? Or something That's a long time, and if we can get things to move smoothly, then you don't need to do that. So 75% of women also experience back pain during labor. We talked about this aspect of the um, sensory system communication with the back, so adjustments can help with that. And chiropractic adjustments have shown that it does decrease the incidence of back labor. Um, and if they get chiropractic during their pregnancy, it does reduce the chance of them even having back labor. Now, as far as things like complications like diabetes and preeclampsia, again, this goes back to overall health and well being. If your body's functioning at a high level, there's less chance of complications. Plus, as a chiropractor, seeing pregnant women, I'm seeing them on a regular basis. If they have pain, I may be seeing them a little bit more, but as we get towards them being more stable, it might be monthly or biweekly. And then during the end of the pregnancy, I'm going to see them a little bit more often. Um, so for those of you who are in LA, you can contact me through my website. And you can also find more information on my website about me and my practice. And there I am working on a newborn baby. It's actually the newborn of a chiropractor. So chiropractors bring me their babies after they give birth, if that is not what they do in their practice. But for those of you not in LA, I will put links to chiropractic pediatric pregnancy certification programs. So you can find a chiropractor in your area who's specially and specifically trained in pregnancy. All right, that's it. I hope you enjoyed this. Give me a thumbs up if you enjoyed this. Share it with your friends and family. Subscribe to the channel as I do post these informational videos at least once a week, and just click on that bell if you want to be notified. All right, everybody, have a great evening. Bye.